Hello, everybody. Is there anyone there? And give some people some time to log on. It is just now 8 o'clock. I've got a couple people here. Where's everyone from? Get started in a little bit, see if anyone else hops on. My name is Jenny Weiner. Oh, I got some people from Columbus. I'm from Columbus. I'll say that in a second when I actually introduce myself. Connecticut? Well, I was about to say thanks for joining from so far since I'm in Columbus, but it's virtual. Huh. Ooh, another Columbus person. I got my Columbus peeps here. Thanks for the support, guys. All right. In the interest of time, I want to go ahead and get started. My name is Jenny Weiner. Good evening, everybody. I'm a pediatric nurse practitioner at Nationwide Children's Hospital in Columbus, Ohio, and I'm excited to be here with you this evening to talk about one of my passions, health literacy. I would like to thank the NAPNAP Team Peds Expert Live group for inviting me to share this passion with you. I became interested in health literacy when I was in school for my DNP and was assigned a CDC module on the impacts of health literacy in my health disparities class. I have made it a goal of mine ever since to take any opportunity to share with anyone the importance of providing information to patients in an easily understood way. There will be some links that I'll share in the chat as the evening goes on and would love for you to peruse them at your leisure. They're excellent resources for you and your families, including tools to evaluate patient education and a pediatric medical dictionary that can be useful when speaking with kids and their families. October is Health Literacy Month, and I'm grateful for the opportunity to spread the word about the importance of this silent disease, if you will. This talk will be divided into what is health literacy, some of the implications of low health literacy on healthcare and patient outcomes, and then some tips and tools on how to share information that is clear and concise with patients and families. I will be available for questions as well afterwards, so go ahead and type whatever you want in the chat when we're done. So the burning question I'm sure you're all wondering is, what is health literacy and why do I care about it? Healthy People 2030 recognizes two components of health literacy: personal and organizational. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Whereas organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. This talk will largely focus on personal health literacy, but I wanted you to be aware of the organizational focus as well and the emphasis on using the information, not just understanding it, to make well-informed decisions. Health literacy itself has multiple components as well and takes into account literacy, which is a set of reading, writing, basic math, speech and comprehension skills, and numeracy, which is a part of literacy that implies a facility with basic probability and numerical concepts. Numeracy, for example, is an understanding that 9 out of 10 also means 90%. Health literacy requires knowledge from many topic areas, including the body, healthy behaviors, and the workings of the health system. It's influenced by the language we speak, our ability to communicate clearly and listen carefully, and our age, socioeconomic status, cultural background, past experiences, cognitive abilities, and mental health. Health literacy is a complex set of skills including reading, comprehending, and analyzing information, decoding instructions, symbols, charts, and diagrams, and weighing risks and benefits, and ultimately making decisions and taking actions that is acquired in a lifelong learning process. It may or may not then come as a surprise to you that a study published in 2006 found that only 12% of the adult population in the United States has a proficient level of health literacy. The levels resulted in 4 categories, which were below basic, basic, intermediate, and proficient. The majority of adults, about 53%, were at the intermediate level, but the remaining 36% of the adult population of the United States were at a basic or below basic level. Sex, race, language, age, education level, and socioeconomic status were all factors in levels of literacy. People, though, who read and write well may struggle with health literacy, and even those with high health literacy can struggle with the recall of information presented verbally. It's one of the reasons they say to take someone with you to an important appointment, since you normally don't retain up to 80% of what is said to you when you're receiving stressful news or are anxious in the moment. And more than half of that is remembered incorrectly. I always tell patients and families to write down any and all questions that they may have after I leave, because I know once I come back and I say, "What questions do you have?" they will forget them all. It's also important to recognize that people with low health literacy can be impossible to spot, which is why I referred to it earlier as a silent disease. The stigma associated with low or limited health literacy may cause someone to just nod along while you're talking, and they may be too scared or embarrassed to ask important questions. And in almost all cases, healthcare providers believe that they are providing clear and understandable directions, when in reality, they actually are likely not. I want to also note here, especially in the post-COVID area, the difficulty of finding reliable, evidence-based information and separating it from misleading clickbait and false advertising is getting harder and harder. That's something that could be a whole other Team Experts Live session. So hopefully by this time, you're beginning to understand or think about what the implications might be of having low or limited health literacy on patient outcomes and equitable care. This is the downer part of the talk, but I promise to end on a high note about what you can do to improve the way you communicate with your patients and families. The United Health Group, which is a Medicare provider, reported in 2020 that improved health literacy can lead to nearly 1 million fewer hospital visits per year, which results in a potential $25.4 billion in savings, as areas with high health literacy in the United States spends an average of $700 less per person on healthcare. There are also higher rates of vaccinations in areas with high health literacy. Studies have linked low health literacy with misunderstanding instructions about prescription medications, medication errors, poor comprehension of nutrition labels, and increased mortality. I wanted to put in a little anecdote here because I still remember this episode, and I think this might be why I latched onto health literacy and haven't let go. Well, one of my favorite shows growing up was ER. Shout out in the comments if you liked that show or even watched it or know what it is, because I am old. But there was an episode, and I don't remember the entire details, but the gist of it has stuck with me for a long time. But there was a young girl brought in with her grandmother. The grandmother was Spanish speaking only, and the patient, I believe, was somnolent or vomiting, or there was some issue, and they ended up diving down and getting to be a new medication that was prescribed a couple days before. And the prescription said to take the tablet once per day. But if you remember, the grandmother who was caring for the child was Spanish speaking. And once in Spanish is once, or 11. So the grandmother was giving her granddaughter the medication 11 times per day and ended up overdosing her granddaughter unintentionally. So that's just one of the things that low health literacy or a language barrier can lead to with the misunderstanding instructions about prescription medications. I just had to throw that in there. It has really stuck with me this whole time. Patients are less knowledgeable about their chronic diseases and are less able to effectively manage a number of chronic diseases such as high blood pressure, chronic renal disease, diabetes, and asthma. Low health literacy of parents is associated with poor health outcomes in pediatrics, such as poor asthma and diabetes, use of EDs, incorrect dispensing of medications, and decreased rates of breastfeeding. I feel like I'm going to hammer this home, but limited health literacy also has psychological costs. Adults with limited health literacy skills report feeling a sense of shame about their skill level. They may hide their struggles with reading or vocabulary. And as a result of this and other issues, limited health literacy is often invisible to healthcare providers and other public health professionals. I want to plug, I don't think that I provided a link to this. I could be wrong, but you can easily Google this. This is not one of the things that I was planning on talking about with my tips and tools to enhance education, but the AHRQ endorses universal precautions. And they have a toolkit specifically for it as it relates to health literacy. So the basic principles of using universal precautions, the same as you would with hand hygiene or wearing a mask into a patient's room, is you always assume that all patients will have difficulty comprehending information. All patients, no matter what they look like, seem like, anything. So you simplify communication and confirm comprehension with every patient to minimize miscommunication. Make sure that your office is easy to navigate, and then support the patient's efforts to improve their health. So now I know all of that can be hard to hear, especially when I haven't offered you any solutions yet, although the toolkit is a good one. But just so we're clear, I do want you to know that addressing health literacy makes a difference. One study found that parents who were taught how to respond to common childhood illnesses and symptoms through a 2-hour class at the Head Start program saw a 40% decrease in clinic visits and a 58% decrease in ED visits, which then translated to a 29% decrease in missed school days and a 42% decrease in missed work days by caregivers. So what are you going to do? In addition to using the universal precautions, I have some suggestions on how to improve health literacy in your area and how to improve communication and understanding with your patients and families. Most interventions involve simplifying and improving written materials, using video or targeted approaches, and improving patient-provider communication. 3 of the steps to boosting health literacy are: be a good communicator with the Ask Me 3 tool, use the Teach Back model, and use plain language. Clear oral communication is essential for optimal care since providers are unlikely to be able to predict, again, which patient or parents will have problems understanding medical information, as I've already discussed. The Ask Me 3 tool specifies that patients minimally need to be able to answer 3 questions related to their medical problem or goals. Those 3 questions are, and these are for your patient to ask you: what is the main problem? What actions do I need to take? And why are the actions important? The discussion from these questions can provide the clinician with an assessment of the patient's understanding of what was communicated to them. The Ask Me 3 program, created by the Partnership for Clear Health Communication, empowers patients to obtain more knowledge about their medical conditions and medications. Next is the Teach Back model, which involves discussing the treatment plan and having the patient or parent repeat care instructions to the provider to validate understanding. You should ask the parent or patient to explain the need to know information. You could start by asking the parent, if you had to explain this to your spouse, a babysitter, or grandparent, how to give this medication, what would you say? This tool makes sure the provider explains the concepts in an understandable manner and allows the provider to correct inaccuracies immediately and reinforce new medications or skills. This strategy has been cited in the evidence as a critical strategy to facilitate understanding and limit the cognitive demands placed on the patient and parent when needing to learn discharge instructions, during consent discussions, and when taking their medications. The final tip tonight, and there are many more that you can find in the links that will be shared in the chat, but this is unfortunately all we have time for tonight. So the final tip is using plain language. Something that can be said to be written in plain language is when information is understood the first time it is read or heard. It allows patients and parents and take appropriate action. The NIH has a great tool for developing materials in plain language that includes a checklist and note cards for referencing, which is included in one of the links that will be provided. When developing or evaluating materials for patients and parents, you want to ask yourself several questions. Who is my audience? What is my purpose? What is my message? How urgent is my message? And what is the need to know and do? Key components for developing the materials include, this is a long list, so stay with me, placing the most important points first, chunking information or breaking complex topics into understandable chunks, using simple living room language rather than technical language. Again, another link that you'll get in the chat is for Nemours Kids Health, which is the Kids Medical Direct Dictionary that I spoke about earlier. You can actually click on a symptom or disease process and have it come up in a way that kids can understand it in plain language that doesn't overwhelm them or talk over their head. And then there's also the CDC has a clear communication index, which actually allows you to run your communication materials through it, and you'll get a score. And I believe it's the higher the better. Obviously, it's a percentage of understandability. The next step is making sure it answers the questions that your parents and patients actually have about particular topics. If you need to use technical language, make sure to provide a definition. Use the active voice. Write in first or second person when possible. Shorter is always better. Paragraphs of 5 sentences, with each sentence containing 10 to 20 words is optimal. However, if you can use a picture, table, or illustration instead of a paragraph, that is more optimal. Use easy to read fonts and have plenty of white space, and make the document skimmable by using headings and numbered or bulleted lists. Make sure that materials are reviewed by the group of people that is your intended audience as well to get feedback on whether or not it's appropriate. One final thing to note here as my time is running out, although I am always grateful when I'm able to use an interpreter so that the language barriers can come down, it is still encouraged and avoid jargon when speaking through an interpreter. Just because it's in their native language does not mean that they understand the technical language any better than they would in English. So, all right, I just threw a lot of information at you in a fairly short amount of time, and for that I apologize, but I want to thank you all for attending and thank NapNap once again for inviting me here tonight. And I would be happy to take any questions you may have if you put them in the chat. I've already found my way to them, so I should be able to read them and get back to you. I'm also happy to provide my contact information if anyone wants to contact me later, especially if we're thinking about it and we comprehended only about 80% or 20% of what I just said. If you have any questions later, feel free to contact me. I'll put my email in the chat right now. Also, thanks for being with me at 8 o'clock on a Tuesday night. This is great. Let's go back and see if I missed it. Okay, I'm not seeing any questions, so that must mean that I explained this all really, really well, and you guys just think that it's perfect. Thank you. Thank you, Mackenzie. Kimberly, curious to know, have you come across whether adding pictures to handouts has improved health literacy for visual learners? Well, as the plain language does say, the more that you can use the pictures or diagrams, it is actually better. You know, they say pictures worth 1,000 words. It literacy doesn't necessarily have to do with how you learn so much as how you are able to understand basic instructions that are given to you. So, as far as the way that people learn, it's not, to my knowledge, it's not necessarily focusing on that. And I actually probably need to look that up myself. Okay, I'm not seeing any more questions or comments. Yeah, exactly, Kimberly. Pictures are worth 1,000 words. So with that, I think I will end this presentation, but I am so very grateful that you are all able to join me tonight. And thank you again for having me. Good night, everyone.